Is therapy the answer to training your brain to think differently or to help you improve your mood? Dr. Joshua Weiner joins us this morning with a look at what is involved in therapy and the potential benefits. Nice to see you. Good morning.
To see you.
All right, see, I think people, when they think of therapy, they think of someone lying on a couch and talking about their problems.
Exactly. Delving into the past, talking about their parents and all the rough things that happen. That's not really what therapy is, for the most part. No, there is a specific type of therapy. Psychoanalytic psychotherapy is becoming less and less common for people to get that type of therapy. In general, what's entailed in seeing a therapist is going in one-on-one, talking with somebody about your current concerns, focusing on what's happening now, not so much focusing on the past.
So what would be the difference between speaking to a professional therapist versus I'm going to sit down with my girlfriend and talk about my problems and what's going on now with her?
Well, number one, there's the training, right? Yep. So the person you're going to sit down with has lots of training in how to help people who are dealing with mental health issues. Number two, it's a confidential relationship. So when you sit down with your friend, there still may be things that, even with your closest friends, you just don't want them to know about. Because you've got to see these people in other settings, and you can't really fully trust that they're going to hold things in confidence. And, you know, friends are just not equipped to deal with everything that is going on with you, and they have their own personal agenda. So when you see a therapist, you're meeting with somebody who has a completely unbiased view, who's coming to the table just trying to help you. I think of seeing a therapist as meeting with a personal trainer for your mental health.
Oh, good way to put that.
That's the way I view it.
And how long are people usually seeing therapists, and how long do you need to see a therapist to get the benefits?
Well, it really depends on the problem that you're seeing the therapist for. So if you're dealing with an acute crisis, a divorce, a death in the family, it's probably going to be a little bit more time limited. If you're dealing with a problem that's been going on for decades, then of course it's going to take time for that issue to hopefully resolve. So generally what you're talking about is a meeting with a therapist on average once a week to start. And then once you start seeing progress and things are going better, then you generally taper down on the frequency to maybe a couple times a month or maybe once a month. In general, I would say that most people are in therapy for about 6 months to a year.
All right. And if someone was seeking a therapist, what sort of advice in finding the right person and the right kind of therapy for you?
Well, I think that you should talk to friends, talk to your doctor, get advice from people who have seen somebody who they highly recommend. That's number one. Number two is it's really important for you to find somebody that you feel comfortable with. This is somebody that you're going to be sharing your most intimate secrets. So you want to make sure that you trust the person, that you feel that you have a rapport, that you respect the person. If those key factors are not present, you need to shop around and find somebody that does enable you to have that level of comfort.
And some people think you have to be going through a traumatic event in your life to seek therapy. Is that true?
I think everybody could benefit from therapy. Everybody has mental health issues that they can improve upon. There's no such thing as perfect mental health. Everybody has some issue that they could address. And again, when you think about it like a personal trainer, everybody has aspects of their physical health that they can improve. So you're just meeting with somebody who's got experience in helping people, and they're going to hopefully help you stay on track and reach your mental health goals.
And what are the different kinds of therapists that are out there?
So this gets confusing for a lot of people. There are psychiatrists like myself, there are licensed clinical social workers, psychologists, licensed professional counselors. All of us do provide psychotherapy. All of us are qualified to do it. And I really think that there is no one person or one degree that enables somebody to be a better therapist than the other. I really think it just depends on the individual therapist and the connection you develop with that therapist.
So you really have to feel that personal connection to make sure that that relationship is going to work.
Exactly.
All
and
right.
if that's not there, look elsewhere.
All right. Thanks so much, Dr. Joshua Weiner. Thanks for joining us with that important information.